to them. They gave them out to our extension workers there, and they showed them how you can send back a qualitative message or a quantitative message. They were texting in from these camps, number of latrines, so just sometimes number of latrines, number of them that are actually working, and number that are collapsed. And we did something in northern Uganda that I think we have never done as an organization before, to our fault, which is that we gathered data from 500 locations in about 30 minutes. We had 50 or 60 phones out, they went around to these camps, texted in the number of latrines, and immediately you got to see data like that appear. And we saw that in 3 or 4 of these camps, all of whom were supplied by one NGO that we support, all of the latrines had collapsed.
All the what?
Latrines. And hepatitis E, which is what the outbreak was there, is spread by fecal matter on the ground, exposed fecal matter, and a contaminated water supply. So the latrine collapse, or lack of usage of latrine, and hepatitis E are totally linked together. So we started looking at these 3 camps, and we started texting back to the people who had sent in this data, saying, oh, can you tell us some more? So they would call in and leave a message. And here you can see that there's a thing that says listen, so you can actually listen to an audio message. Because we think that that type of interaction is quite important. And they would leave messages explaining why their latrines had collapsed. And what they said was, we keep telling this NGO not to build them in an XYZ place, and they do it anyway. And the soil there is very soft, latrine collapsed, people fell in, somebody died, and nobody wants to use the latrine anymore. And so just from that, and for one day of work, you gather all this information. And this is what we need to do. This is how we need to innovate as a community. And I'd like to pose a challenge at the end to everybody here to think about how we can collectively work together on it. I'd also like to think about how we can make what we consider to be governance become actually a system of participation and engagement. So that it's not that one government has to be all the way in charge of their emergency program, or one organization has to be in charge of education. But that if you can establish these systems of communication and pathways of communication for young people, the need for strict governance lessens. And what you actually find is that you get this bottom of the pyramid taking a community pulse, which changes their own behavior. And I think that's really the model that we want to look at. That we need to make sure that the elements that we're dealing with are already there in society. This isn't something that you bring in, oh, here's a very fancy thing that you can use. It's things that people are working with anyway. People have mobile phones, they have access to them. So how do we start to engage youth reporters, youth monitors of their schools in really vital development work? And I think the answer to that is to look at the groups that we work with, that our partners work with. This graphic here is a product that we're building with an anarchist group, which is very interesting. So UNICEF has signed a contract with an anarchist group, which is in itself a difficult thing to do. And what they have developed, the group is called Rise Up, they've developed a way for communities to interact with each other online. And so you have an individual and you have a group and they have thematic issues. UNICEF has a problem that will often bring kids to an event. They'll fly out to the J8 in Japan, which is the junior version of the G8. 100 kids will talk together, we've paid for their airfares, they fly back, and then it's over. We need to make participation not be tokenistic, not be one time, and to engage them over time. And so we're looking at this idea of a social networking platform meets a community sharing of information platform. And how do you make this accessible to mobile phones? So how do you let your group on here, who's maybe sitting in Ghana working on building latrines, text a group in Sudan and find out what their solutions have been? How do you let people take opinion polls and actually to change the way that governments deal with their youth communities? How do you look at specific groups or general groups in a community? And so I'd like to also talk a little bit with everybody about how that idea of group communication versus individual communication might sort of influence our work. Just at the end, if SMS can move somebody from one place to another, it's very clear. Everybody's heard about the crop prices. And I'd also invite you to check out this Web for Dev conference, which is coming up in February in New York. We're inviting sort of thought leaders from academia, private sector, and development to New York.
Start with the code. Otherwise, it doesn't know where it's living. It's perfect. So pick something else. Don't put kids there.
I was saying the hospital recruited about 600 community health workers as volunteers. And HIV/AIDS, some of them as counselors, some of these people they are working as home-based care providers, some of them they are working as productive health providers, youth counselors, ART drug adherence monitors. So at first, disconnection from hospital services and resources, these community health workers' ability to assist people in the village was limited. So somebody from the US just brought in this Frontline SMS so that to facilitate communication between the hospital and the community through these volunteers. So as a pilot program, we distributed about 100 phones to these people in different villages so that they should update us as a hospital with their reports, patient updates. Sometimes when they are in need of hospital staff to visit the community, they always text emergency messages to the hospital so that we are prepared and we know where are we supposed to go, what kind of patient are we going to see, because they always give us patient details and status, how the patient over there. So it's like it has facilitated communication. At first they used their bicycles traveling long distance just to report the hospital how they are doing in the community. But with this system, Frontline SMS, they are able to text directly to the hospital, and we can even respond in time. Sure, in short, that's how this thing is working. Yeah, but
Can I see how it works?
yes. It looks like this when you have opened. So here it's like I'm at home. This tab, that's where I can find the contacts. Here we come here, we press here. For example, these are the names of some of the names of volunteers and their phone numbers. See? So if I want, for example, Alex Mtonya, I'll come here. Alex Mtonya, yes. Then I'll come here to Dan. It means here now I'm ready. This is the phone number of Alex Mtonya. Here I'm ready to write whatever I want to write, the message to this man. So when I'm ready, I'll just come here, send. Because I don't have a modem, but there's a word send here. So I'll simply send this message to this volunteer. Once he receives this message, you'll be able to know that it's the hospital, they are asking for this, he will respond. And the message will be displayed. When I want to read my message and this message, I'll come here on the message tab. So to read
Necessary information that the hospital needs about the patient.
yes, and the feedback. Yeah, both messages are shown here. So I will come to all messages here. It will show the status of the messages I've sent, whether sent or failed or received or delivered. So if he has given us a feedback, it will tell us that we have received a message from such sender, date. Recipient will be a volunteer or the hospital. And here you have the whole message. We'll read.
Yeah, the text. Yeah.
Yes. Sure.
And it's an open space, but this is easy to download, or
Yeah? Pardon?
easy to download.
Yeah, it's easy to download, but I think here you can do it. I've got my colleague who is, I'm not a technician anymore. Yeah, I'm just a user.
Okay.
So I don't know the
technicality.
Yeah, I'm not sure. Yeah, I'm just a user, but there's my friend who knows how.
More about it.
Yes, technical side of it.
Okay. Thanks.
Yes. Okay. Welcome.